evening. I'm Maria Muro. Welcome back to our show. Tonight our topic is heart disease. Did you know that heart disease is the leading cause of death in the U.S.? So tonight we're honored to have one of the leading experts in heart disease right here on our show. Dr. Kushner received his medical degree from Columbia University. He completed a residency in internal medicine at Harvard University and his cardiovascular fellowship with the University of Pennsylvania at Harvard Medical School at the Massachusetts General Hospital. He is board certified in interventional cardiology, cardiovascular diseases, and internal medicine, and we're excited to have him on the show tonight. Dr. Kushner, thank you so much for being here.
Thank you for having me, Maria.
I know you're a really busy physician, and you were out of town in San Francisco talking, at a convention and kind of moderating a whole big group of cardiologists. Is that true?
Yes, that is true.
Okay. So tell me about you, Dr. Kushner. Before we get started, about our actual topic of heart disease, I always like to know why a physician chooses a certain specialty. So why cardiology? Well,
that's a good question. So when I was a kid in middle school, on the news was a tremendous development. It was the first human heart transplant, which happened in South Africa, and that fired my imagination, and ever since then I've wanted to be a cardiologist.
Wow, I think that's a great story. And did you have any of your family members who were physicians, or is it just you and your family?
Actually, my father was a dentist.
Okay.
So he wanted me to follow in his footsteps, but I thought that this was more interesting, and so I ended up being a cardiologist.
And at least you're not looking down people's throats all day. All right. So, Dr. Kushner, let's talk about your practice, okay? As a cardiologist, I'm sure you see, different people from different cultures and areas of the city. Tell me about, the type of diseases that you manage and treat in your patient base.
So I have a wonderful patient base, and it's a pretty good cross-section of normal people. I mean, I see patients from late childhood all the way through older adults with all different diseases referenced to the heart, including coronary artery disease, some congenital heart disease, arrhythmia management, cholesterol problems, high blood pressure, congestive heart failure, all of the typical spectrum of heart disease that we see. And my patient population encompasses all the various nationalities and representatives in the area, Vietnamese and Latinos and African Americans and people who from Italy and from Ireland initially and Germany. Everybody, the big melting pot that's New Orleans is represented in our practice.
Absolutely. And practicing at West Jefferson Medical Center, I know that there's, really, again, it's a great, strong community, very tight-knit. And I know that, West Jefferson Medical Center itself is very, very committed to, really taking care of their people. I know they have, physicians who speak Vietnamese, physicians who speak Spanish. So they're really, really, I think they've really personalized medicine in that area.
It's one of the things that attracted me to that area is that it's truly a great community hospital, great community medical center.
And I know that you as a cardiologist with heart disease, the #1, obviously, cause of death in our country, you're very, very busy. So let's get started. We hear about heart disease, heart failure, cholesterol. There's a lot of different, topics concerning heart disease. But what exactly is heart disease? What does that mean?
So actually there are a lot of different diseases of the heart, but the ones that people are most familiar with and that occur most often in the population are the diseases called arteriosclerosis or atherosclerosis, or coronary artery disease, which is a buildup of plaque in the arteries that lead to the heart muscle and can starve the heart muscle of necessary blood and oxygen. Okay.
And what exactly causes heart disease?
So the particular kind of heart disease that we were just talking about is caused by an inflammation of the lining of the arteries, and that inflammation leads to a development of a plaque. The plaque is made out of elements including fats, inflammatory tissue. That plaque can eventually build up inside the artery and narrow the artery, limiting the blood flow. And in a condition of a heart attack, or what we call an acute coronary syndrome, the plaque can actually rupture inside the artery and cause a blood clot and completely obstruct the blood supply.
Okay.
And that's what a heart attack is.
And that's what a heart attack is. And I know we hear, about people getting heart attacks, I think every single hour in this country. But what I want to talk about is with heart attacks and heart disease in particular, is it something that's typically hereditary or genetic?
So it turns out that it's not something just simple as either all environment or all hereditary. It's always a combination of both.
Okay.
And from 1948 on, a large study was done in Framingham, Massachusetts, to try to identify the factors that led to heart disease. And it's a famous study, it's called the Framingham Risk Study. And they studied every man, woman, and child in Framingham, Massachusetts, longitudinally from 1948, and the study is still going on. And the famous, quote, risk factor assessment comes from that study. A family history is a very important part of that.
Okay.
If you have a family history, especially of early heart disease, before the age of 65, for instance, that's a very increased risk factor. High blood pressure, smoking, high cholesterol, diabetes, obesity, these are all what we call the risk factors for developing heart disease, and smoking, of course.
Okay. And Dr. Kushner, when we hear about, heart disease being the silent killer of women in this country, what does that mean? Does that mean that people are just not getting screened? Women are very active. A lot of women have a lot of stress, with career, taking care of their kids. Let's talk about, the number of women in this country who are actually affected by heart disease.
Well, I'm glad you brought that up, because a lot of people don't really understand or appreciate the fact that the leading cause of death in women in this country is heart disease and not cancer. Right. Most people assume that it would be cancer, but it's actually heart disease. And it's the same heart disease that we've been talking about. Often the symptoms of the heart disease may be a little different in women than they are in men, and sometimes they're missed.
Okay.
And when you say silent killer, that brings up another very important point, which is that many people, their first symptom of heart disease is sudden death, and so they never make it to the hospital. So it's important to identify the risk factors and be aware of your feelings and your symptoms, and seek medical attention when you see something that is not right and amiss. Just because you're a woman doesn't let you off the hook. And
what about women who are active, they're thin, they eat right, but yet, you hear about them just, having a heart attack? How does that happen?
It happens because it may happen because they have a family history and their genetics are such that they have very high cholesterol. Maybe they smoke, maybe they have high blood pressure also, and even though they're thin and they seem to be in good shape, the inside of their arteries is inflamed, and that inflammation can lead to the plaque, and the plaque rupture that we talked about that can cause a heart attack.
Okay. And Dr. Kushner, what about African Americans in our community? Are they more prone to heart disease than, let's say, Caucasians?
Not necessarily, but African Americans are prone to having high blood pressure, and also sometimes because of socioeconomic factors, they don't receive and seek attention early enough in the process to really interrupt the disease process.
Well, last year, Dr. Kushner had a wonderful guest on our show. I'll never forget it. Her name was Pastel Williams. She was 48 years old, a single mom, wonderful. She actually was on one of my other shows, and she won a pie baking contest. And 5 days after she was on this show, I got a call that she just died suddenly of a heart attack. Okay, and I was just shocked. She had a young daughter who was 14, and that really, she looked healthy. She was a little overweight, but you would never think, wow, this woman is here today, and then, this 14-year-old daughter loses her mother. I'm sure that's something that you see a lot in your practice, where somebody just loses a parent.
We do. It's shocking, especially it's shocking when you see a young, healthy, vital person all of a sudden having a fatal heart attack.
And I have to bring this up. What about stress?
So stress is, in a sense, not a traditional risk factor, but stress can raise blood pressure, can increase this flight or fright hormones in the body that can raise blood pressure, can make your blood clotting elements, platelets, sticky, and in a sense, it can precipitate sometimes a heart condition that's already there, latent and dormant.
Okay. Well, I just want to let our viewers know that the phone lines are open. So if you have a question for Dr. Kushner, he's here to help you. So please call in. Don't be shy. All right. So let's continue. Let's talk about coronary artery disease, something we hear a lot about, CAD. You know, tell me what exactly is this disease and what causes it?
So this is this disease of plaque building up in the coronary arteries. The coronary arteries are the arteries that actually supply the heart muscle, and the heart muscle, of course, is the pump that pumps blood around and oxygen around to all of the other tissues of the body. Well, it needs its own blood supply to work, and its blood supply are these coronary arteries. There are 3 main coronary arteries, and the plaque can build up in those just like it can build up in any artery in the body. And if it builds up enough and a plaque ruptures and a blood clot forms and obstructs the blood flow to the heart muscle itself, part of the heart muscle will die and form a scar, and that's a heart attack.
And that's a heart attack. Okay. So that is a heart attack. And now, what are the symptoms to look for a heart attack? Like you said, a lot of times you'll have somebody who was fine, and then all of a sudden it's instant death. But there are other people who've had a heart attack and have survived. So can you please walk us through that and explain again what to look for, and if somebody hasn't been well, is it shortness of breath? Tell me about what we need to learn about heart attack.
So this is very important that we're talking about symptoms of heart attack. And the reason I say that is that in the last 15 years, we've been very successful at extending people's lives and saving people who have had heart attacks, because we get them immediately into the hospital, and we can restore the blood supply through the occluded artery by putting a balloon or a stent in and opening the artery back up and actually stopping the heart attack. And so we've been very good at this and doing this within 60 to 90 minutes. Wow. Stops the heart attack. The patient has much less heart damage, and they can leave the hospital in a few days often and have a very low mortality. But the biggest problem we have is that many people, too many people, don't recognize that they're having a heart attack, and they don't call 911, and they don't seek medical attention. So on the average, 2 to 3 hours goes by before they ever seek medical attention. Wow. And because of that, the amount of damage that they suffer is actually very large. Wow. So the symptoms are very important to be aware of, and they include a heavy pressure-like feeling on the chest. Sometimes it's described as an elephant sitting on their chest. It's accompanied usually by shortness of breath, a feeling of being unwell, sweaty, clamminess, sometimes discomfort in the jaw or the arm or the shoulder. But occasionally, women and older people can have what we call atypical symptoms. That's symptoms that are not the usual. Okay. And they can be sharp pains. It could be no pain at all, just a feeling of breathlessness or nausea, for instance. But if you feel anything really out of the way unusual and it's lasting for more than 10 or 15 minutes, you should play it safe, not drive yourself to the hospital,
okay, that's well
not
said.
Walk to the hospital, pick up the phone, that's what it's there for, 911, get yourself into the emergency room so you can get medical attention promptly.
And what about, I think, that is so well said, and just great information for our viewers today. What about if some of these symptoms are happening to a younger person? Should they still take that same course of action and call? Because you're hearing about athletes, let's talk about that. These young athletic men, women who are getting heart attacks. Why is that?
So if you're thinking about the young, especially the professional athletes who suddenly have a cardiac arrest, that's not usually the same disease that we're talking about now with coronary artery disease. That's usually or often an irregular heart rhythm that can become fatal, and often or sometimes accompanied by a congenital disease, meaning a disease that they were born with, of a disorganization and a thickening of the muscle of the heart. It's called a hypertrophic cardiomyopathy. And that sometimes can lead to a fatal irregular heart rhythm, which is why it's important to have defibrillators around. And we want defibrillators around in public spaces, and everybody should learn how to use an automatic external defibrillator. It's very easy, because if someone has a cardiac arrest, you may be the first responder and you may save that person's life.
And how does someone learn how to use one of those? I've seen them around,
They're very easy. First of all, they're self-explanatory. You open up the box and it tells you what to do, 1, 2, 3. Wow. It actually has a voice set of commands that walks you through it. But if you contact your local American Heart Association, which is here in our local area, they provide classes and instruction on how to use an AED and also how to provide CPR.
That's fantastic. I was not aware of that, and I think especially for businesses, you know, where you have many employees in one place, I think that's super important to, you know, to be aware that you can actually get this, you know, learn how to use that from the American Heart Association. All right, so let's continue. What about, let's talk about congestive heart failure.
So congestive heart failure is a condition, it's what we call a syndrome, which is a collection of symptoms and a condition that is when the heart muscle itself is failing as a pump. It's failing as a pump because it's not strong enough. It's been damaged, for instance, in a heart attack, and it's not strong enough to pump the blood to the other organs of the body. And so the other organs of the body suffer because of lack of oxygen and inability to conserve water and sodium. And it also is not working at as a pump well, and fluid backs up into the lungs. And so that's the congestive part of congestive heart failure. Okay,
we're going to continue on that topic. We have someone waiting to speak with you. We have Edward on the line. Good evening, Edward. How are you? Do we have Edward on the line?
Yes.
Yes. Hi, Edward. How can we help you? Do you have a question for Dr.
I wanted to ask the doctor. I just was listening about the shoulder thing. Now, I had rotator cuff surgery on both my shoulders, and I get pain from time to time. And I never did hear of your shoulder hurting. I know about the elephant on the chest. And I had been diagnosed a couple of years ago with a left bundle branch block. And I'm not quite sure how bad that is. I take Coreg for it, and I've been doing fine. But I'm just wondering, like, I would be scared, like, if it's something real serious or it's just a minor heart ailment.
Okay, so there are two questions here. The first is your shoulder pain from your rotator cuff surgery a symptom of a heart attack? Probably not. You know, lots of things can cause shoulder pain. Only one of them is a condition from the heart. So usually it's more than just a shoulder discomfort that makes you suspicious of a heart attack. It's these other things like shortness of breath, etc. And if you know that you have a rotator cuff condition and it hurts when you move your shoulder, that's probably not your heart. Of course, though, if out of the blue you have sudden aching in your shoulder and your left arm and you don't feel well otherwise, that could be a heart attack. Your other situation, left bundle branch block, is not an actual block in an artery. It's a little bit of a misnomer. It's referring to an electrical system block in one of the wires, in a sense, that leads the electrical conductivity of the heart. So it's a completely different thing than a blockage in an artery that can cause a heart attack. And your doctor can explain that to you a little bit more. It's not the same thing at all.
Thanks for that call. We have Iris on the line. Good evening, Iris. You have a question for Dr. Kushner?
Yes, I do. I've had a stroke like 7 years ago, and I seem to be fine. Sometimes I will get what feels like a rush of heat, or the only thing I can assimilate it to would be like blood flow. And it starts like at my feet, and it just goes up my legs, up my body. And it really, it frightens me because I don't know what that is. Could that be related to a heart attack?
It doesn't sound very much like a heart attack, but what I would suggest that you do is if you've had a stroke, maybe you have high blood pressure, I don't know, but you should have a blood pressure cuff. You can get one and take it at home. And when you have your symptoms, your feelings, you may want to take your blood pressure and see what's happening to your blood pressure. And then I would report your symptoms to your doctor, who can do a physical exam, record your blood pressure, and maybe he can sort it out what exactly this might be. It could be lots of different things. What you've described could be a lot of different conditions, but I would suggest that you might want to have a blood pressure cuff at home to check your blood pressure periodically.
Thanks for your call, Iris. All right, so doctor, she just brought up stroke. You know, for those people watching the show tonight, we hear a lot about a stroke, but you know, some people wonder, is it something that affects the heart, the brain? You know, tell me about a stroke. What is it? Who gets it? How do you treat it?
Okay, very good question. So just like I told you that you could have plaque buildup in the arteries going to the heart, you can have plaque buildup in the arteries that are going to the brain. And there are 4 major arteries that supply the brain, and the plaque can build up in those arteries, and if the plaque narrows the artery enough, or a blood clot obstructs the artery because of a ruptured plaque that's inflamed, it stops the blood supply to the brain, and the brain is very sensitive to lack of blood and oxygen, and part of the brain tissue dies, and that's a stroke.
Okay, and we're going to continue because I want to talk about the stroke, you know, the post-stroke treatment, because we have somebody on the line. We have James. Good evening, James. How are you?
I'm doing great. How are you?
Fantastic. You have a question for Dr. Kushner this evening?
Yeah. Yes. My question is that I've been diagnosed with AFib, and they had me on a blood thinner called Pradaxil, and I was just trying to figure out how you feel about blood thinners and stuff like that, because you hear so many stories about those blood thinners today.
Okay, that's a good question. So atrial fibrillation, or AFib, is a condition where the top 2 chambers of the heart, instead of beating in a coordinated fashion and pushing blood into the lower pumping chambers, they just sit there and sort of wiggle. They're not coordinated in their contraction. And because they're not coordinated, blood can stagnate in those 2 chambers, and blood clots can form, which is why if you have atrial fibrillation and you have certain other risk factors, and your doctor can calculate what your risk for a stroke is using something called the CHADS-2 score. If your CHADS-2 score is 2 or greater, your doctor will probably recommend a blood thinner like Pradaxa, or Coumadin, or warfarin, or Xarelto, or Eliquis, which are all the blood thinners used for this, to prevent you from getting a blood clot that could break off and cause a stroke, assuming that you don't have a higher risk of bleeding for some reason. Because just like a blood thinner can reduce a blood clot and reduce the risk of stroke, it can also make bleeding worse. So there's always the balance between the risk of bleeding and the risk of blood clotting or a stroke.
That was a great question. All right, we have Ann that's been waiting for you. Good evening, Ann. You have a question for Dr. Kushner.
Yes, I do. Could he discuss the components of a stress test and what that information gives the doctor regarding heart functioning?
Great questions.
Okay, so a stress test is usually ordered for someone who is having some sort of chest discomfort, to be sure that the chest discomfort, or to try to determine if the chest discomfort is secondary to a blocked artery, coronary artery disease. And the way it's done is the patient is hooked up to an electrocardiograph machine, which checks your electrocardiogram continuously, and you start off at a low level of exercise on a treadmill, and that exercise is gradually increased so that you're working harder, you're walking faster, and you're walking on an incline, and the extra activity makes the heart work harder, it beats faster, and your blood pressure goes up. And the doctor monitors the electrocardiogram, he also monitors how you're feeling, and he also monitors, or she monitors, what your blood pressure is doing. And all of those factors together can tell us how the condition of the heart is and whether there's a danger that there might be a lack of blood supply, for instance, to the heart muscle, by looking for changes on the electrocardiogram, the blood pressure, your symptoms, etc.
Fantastic. Thank you so much, Dr. Kushner. So let's go back to stroke. You know, you told us what a stroke is, but now are there any symptoms when it comes to a stroke that we can look out for? Yes.
So broadly speaking, there are 2 kinds of strokes. There's what we call the hemorrhagic stroke, which is a stroke that's caused by bleeding in the brain. Okay. And there's an ischemic stroke caused by a blocked artery. Both of them can cause death of brain tissue. The hemorrhagic stroke usually happens in people who have high blood pressure, and a small blood vessel bursts in the brain. The brain is enclosed in the bony skull and doesn't have room to move around, and that blood clot expands and can compress and squash the brain tissue and cause damage, and that's usually heralded by extreme headache, a very sudden onset of a headache, and then signs and symptoms that something isn't going right. Weakness or numbness of a part of the body, inability to speak, something of that sort.
A slurred speech.
Inability to speak, inability to move, change in the way you feel something. An ischemic stroke caused by a blocked vessel won't necessarily be accompanied by the sudden onset of a heart attack, but will also have those neurologic findings, slurred speech, the problem with movement, the problem with thinking, the problem with recognizing speech, the problem with feeling on one side of the body or the other. Those are all symptoms of a stroke.
Okay. And, you know, what's been in the news recently is this mini stroke with the coach who, I don't know, I don't know which, I don't remember the team. I don't watch too much football, but, you know, I just read a headline about my producer just told me Houston. He's the coach for the Houston team. What is a mini stroke that we've just heard about?
Okay. Mini stroke is often called a TIA, or transient ischemic attack. The signs and symptoms are all the same as a stroke, but it's temporary. All those findings are reversible, often within minutes to hours. And that's because perhaps there's a narrowed artery, a little blood clot or a piece of material breaks off into the brain, but then it washes out or it's dissolved, and the blood supply is restored before there's any permanent damage done.
And so if someone
that's a warning.
Okay, a warning, I was going to say. So that's a warning that obviously you have to...
Something's wrong.
Something's wrong,
You need to go to see your doctor, because the risk of a permanent stroke is the highest after someone has had a mini stroke or a transient ischemic attack.
And so what are the risk factors of stroke?
Risk factors of stroke are very similar to the risk factors for developing heart disease, because the disease process is very similar. So smoking, high blood pressure, high cholesterol, a family history, these are all the risk factors for developing stroke.
And we're going to talk about these type of lifestyle risk factors like smoking and diet. We're going to get to that, but you know, my question is can these risk factors be reversed?
Yes.
Or they can completely be reversed, or?
Well, a large part of them can be reversed.
That's good news.
Lifestyle modification can lead to better health and reduced disease burden. It's very important to do these lifestyle changes, because yes, that can make a huge difference in not only the mortality, your risk of death, but also morbidity, your risk of further disease. Okay.
We're going to be running out of time. This so much great information here. So let's get to the diet and lifestyle. When I think about heart disease, the first thing I think about is high cholesterol. So, and I know that a lot of people watching the show tonight have high cholesterol. Let's talk about what is cholesterol, and I know that there's good cholesterol and bad cholesterol, and what the difference is between the two.
So everybody needs cholesterol. A large number of the tissues in your body, especially your brain, are made of chemicals. Cell membranes are made of chemicals that are related or derived from cholesterol. The majority of the cholesterol in your body is actually manufactured by your liver. And the amount that your liver manufactures is determined to a large extent, about 80% genetically, on a set point that is varied according to the amount of cholesterol in your blood. There's a feedback loop. The liver sees how much is there, and if it thinks it's not enough, it makes more. If it thinks it's too much, it'll shut down the factory. About 15% or so is how much saturated fat and cholesterol you eat. But the majority is actually manufactured by the liver. Some people have a series of genes that makes their set point too high, and they make too much of either the bad or the good cholesterol, especially the bad cholesterol. The bad cholesterol is called the LDL, low-density lipoprotein. That's the bad actor that can tend to cause atherosclerosis, or the buildup of that plaque that we were talking about.
All right. Thank you, Dr. Kushner. We have Sherry on the line. Sherry, you have a question for Dr. Kushner?
Yes, hi. My question is, I've heard that if you're feeling symptoms of a heart attack coming on, that you should take or chew on an aspirin or a baby aspirin. Is that a good idea?
Yes, definitely. It's a very good idea. Aspirin stops the sticky elements in the blood that cause blood clots from pooling or sticking together, and can help reduce the blood clot burden. And it's a very important part of heart attack treatment, and it's something that can be done very early in a heart attack, can be very helpful. So yes, that's an excellent idea.
Excellent. And we have some questions that came in earlier via email, and one of them is about smoking. One gentleman wrote in and said, "Doctor, I smoke 3 packs of cigarettes a day. I'm 45. I'm male. Does this give me a greater risk of developing heart disease?"
Gives you a 10 times increased risk of developing heart disease and stroke. That's not even mentioning the risk of developing lung cancer and emphysema. So yes, smoking is a major, major risk factor, especially 3 packs a day.
Yeah, 3 packs a day, that's a lot. And that'll be for another show on why we need to quit smoking as soon as possible and how to do it. And okay, we only have 5 minutes left, so I'm not going to go through all the questions, but I just, want you to give us an overview on, lifestyle management and also prevention. Just give me the scoop, about diet and exercise and all the good stuff that, our viewers need to know on making positive changes in their life so they're not affected by heart disease.
So lifestyle management is very, very important. It can promote a healthy heart and a healthy body in general. And it's in terms of diet, I recommend 3 diets that are out there. The first is the American Heart Association diet, and you can access that by looking online at the American Heart Association site, americanheart.org. The other 2 diets that I recommend are the USDA Food Triangle, and or pyramid it's called, and the DASH diet, that's capital D, capital A, capital S, capital H. And that's also online. It gives you recipes. Any of those 3 diets are heart and brain healthy diets. So it's very important. Prevention is our biggest ally in preventing disease before it occurs. And the other thing I want to emphasize is the symptoms that I talked about for a heart attack. If someone's having those symptoms, please don't wait for 3 hours. Get to a hospital early. It shouldn't be embarrassing for anybody to go to the hospital if they're thinking they're having a heart attack. We want you to come early so that we can treat it early and save your life.
Absolutely. And doctor, that was just so fantastic. And lastly, what about exercise? I mean, is that equally as important, or is diet the #1 thing that people need to take control of? Because I know living in New Orleans, it's tough. Fried food, great food. Right. How do you deal with that? I mean, moderation, obviously.
It's tough.
It's tough.
Exercise is very, very important. I can't say that it's as important, but it is extremely important. Regular exercise, a half an hour a day, can really help prevent heart disease, can help prevent stroke, to a certain extent can help prevent cancers. So that's very, very important as well.
Okay, and doctor, to finalize, how often should people get screened? If you've never had, if you've never seen a cardiologist, is it something that you can just pick up the phone and make an appointment and say, you know what, I need to get my heart checked, especially if you had, a history of heart disease? What do you recommend for screenings?
So I think every adult, as they reach adulthood, should be screened for certain things, and it doesn't have to be a cardiologist. It could be your general practitioner or an internist. You should have your blood pressure checked. You should have your cholesterol checked. You should have, and you can go online and do this yourself, you should take your own test, look at the Framingham risk score online, and this will tell you what your 10 and 20-year risk for developing heart disease and stroke is. and you should know your numbers.
Know your numbers. All right. This great information. Dr. Kushner, thank you so much for being here. We really appreciate it, and we'd love to see you again. All right. So for those of you who want to contact Dr. Kushner's office, you can call 504-349-6800, or you can visit his website at heartclinicoflouisiana.com. I'm Maria Muro, and I want to thank you for tuning in to Doctors New Orleans. Remember, if it's about health, we cover it, and we want to hear from you. Thank you for your calls tonight. We hope you found the show informative, educational, and inspirational. Stay healthy, and good night.
Doctors New Orleans